Hello friends, today we are going to discuss again another set of questions while learners in relation to pediatrics. To start with, which vitamin is known as vitamin H? Answer is biotin. Biotin is known as vitamin H. What? Deficiency of biotin causes hyperasthesia, hallucination, dermatitis, like alopecia. Some more important one-liners. Pantothenic acid is also referred to as vitamin B5. Essential fatty acid used to be termed as queen of vitamins. It may be asked which is known as the queen of vitamins. It is essential fatty acid. Essential fatty acid is also designated as vitamin F. Next question. Most specific CNS malformation seen in a baby born to diabetic mother. As you know, baby born to a diabetic mother can have several abnormalities. Then, which is the most specific CNS malformation that we can get? Answer is caudal regression syndrome. Some important note what we can get in a baby born to diabetic mother. We can get macrosomia, we can get metabolic abnormality, we can get hypoxemia, respiratory distress syndrome, and congenital malformation. Macrosomia associated with septal hypertrophy, cardiomegaly, LGA, birth trauma, cesarean section delivery because of macrosomia baby. And metabolic abnormality, what we can get is hypoglycemia, hypocalcemia, and hypomagnesemia. Similarly, we can get polycythemia, renal vein thrombosis, and hyperbilirubinemia. Respiratory distress syndrome is common because of the surfactant synthesis will be hampered. That can cause respiratory distress syndrome. Congenital anomaly, other most specific is caudal regression syndrome. Other neural tubule defects also we can also get small left colon syndrome, and we can also get some heart disease like your VST, TGA, conotrachal malformation. Next, which strain is used in measles vaccine? As you know, measles vaccine, the which strain we are commonly using? That is, answer is Edmondson-Zagreb strain. Measles vaccine, to discuss, is a live vaccine. Either we can get MR or MMR. MR we are getting in our government setup as per your NIS, and MMR as per IAP. It is the lyophilized form. The vaccine given at 9 months, 15 months, and 5 years. The dose MR vaccine to be given measles vaccine or MR or MMR, the dose is 0.5 cc and route is subcutaneous. Next, the scoring system mostly used to assess respiratory distress in a preterm baby with RDS, respiratory distress syndrome, is there are two scoring systems are there. The commonly which we are using is your Silverman-Anderson scoring. Silverman-Anderson scoring, the retraction score, how it is calculated. The points are upper chest retraction, lower chest retraction, Gifford retraction, nasal flaring, and grunt. Upper chest, lower chest, Gifford, nasal flaring, and grunting. These are the 5 criteria which should be included, and the scoring system is 0, 1, or 2, and accordingly after calculating, if the score is more than 6, it indicates impending respiratory failure. Other system which we are using is Downey scoring. Downey scoring, what are the criteria? One is easy to remember is cigarette, C cyanosis, G grunting, rate, respiratory rate, air entry, and retraction. So what are the scoring system what we are using is your Downey scoring is cyanosis, grunting, air entry, respiratory rate, and retraction. These are the 3, 0, 1, and 2. 3 criteria, the 3 scoring system. If the total score is 0 to 3, then this is a mild variety. If score is 4 to 6, it's a moderate variety. If score is 7 to 10, then it's a severe variety. If score is more than 6, it indicates impending respiratory failure. So you have to remember Anderson scoring and your Downey scoring. Next, parahemophilia is due to deficiency of which factor? Answer is factor 5. Then to know hemophilia A is due to deficiency of factor 8. sorry, it's wrongly printed as factor 10. Its hemophilia A is factor 8, hemophilia B is your factor 9, hemophilia C is due to deficiency of factor 11, para hemophilia is deficiency of factor 5, para 5, easy to remember, para hemophilia is due to deficiency of factor 5. Then another question somebody may ask, what do you mean by pseudohemophilia, or which one is known as pseudohemophilia? The answer is 400 factor deficiency, the category is type 2N. It is known as pseudohemophilia. It is due to the defect in ability of the 400 factor to bind to factor 8. That will lead to bleeding, and it is also known as pseudohemophilia. So factor 5 deficiency is called as parahemophilia. Next, what do we mean by internal hydrocephalus? As you know, one is internal hydrocephalus, one is external hydrocephalus. The answer is your non-communicating hydrocephalus is known as internal hydrocephalus. It is also known as obstructive hydrocephalus. Then if it is internal hydrocephalus, then which one is known as your external hydrocephalus? Your communicating hydrocephalus is known as external hydrocephalus. Communicating hydrocephalus, because of the defect in the absorption in the subarachnoid granulations, that is known as outside the foreventricular system, that is communicating hydrocephalus, or it is known as external hydrocephalus. Your internal hydrocephalus confined to your four ventricles, so it is known as internal hydrocephalus or non-communicating hydrocephalus. Then another question, what do you mean by hydrocephalus ex vacuo? Hydrocephalus ex vacuo is hydrocephalus because of the dilatation, compensated dilatation of the ventricles in relation to the cerebral atrophy. Suppose there is cerebral atrophy, then there will be compensated dilatation of the ventricles. That is known as hydrocephalus ex vacuo. Next, which variety of neurofibroma is known as peripheral neurofibromatosis? Neurofibromatosis, as you know, two types, type 1 and type 2. Your type 1 variety is known as peripheral neurofibromatosis. Your type 2 variety is known as central neurofibromatosis. Your type 1 neurofibromatosis is also known as von Reckling-Nicholson disease. The chromosome NF1 is linked to your chromosome number 17, and chromosome number 22 is linked by your neurofibromatosis type 2. So type 2, 22. Type 1 is 17. And what are the characteristics of neurofibromatosis type 1? It is 6 or more capillate spots of size more than 5 or more than 15 mm, pre-adolescent and adolescent variety. The number has to be 6 or more freckling, axillary or inguinal freckling, 2 or more neurofibroma, your optic glyma, 2 or more least nodule, and bone deformity like your sphenoid dysplasia. These are the criteria. These are the criteria which 2 has to be there to say this is a variety of neurofibromatosis type 1. This we have to remember. Next, which variety of rickets is associated with alopecia and ectodermal dysplasia? There are many forms of rickets are there. Nutritional rickets, vitamin D dependent rickets, X-linked hypophosphatemia rickets. Many forms are there. To know which variety of rickets is associated with alopecia and ectodermal defect, the answer is vitamin D dependent rickets type 2. Type 2, where we can get alopecia and ectodermal defects. This is the classical picture of a patient of vitamin D dependent rickets type 2. Then what do you mean by type 1 vitamin D dependent rickets? It is one of the autosomal recessive form. It is due to the mutation in the renal form of 1-alpha hydroxylase enzyme will be defective. That can cause your type 1 variety of vitamin D dependent rickets. Their presentation in early life. Then what are the biochemical findings? Here we can get 25 hydroxylase vitamin D is normal, but because of the defect in the 1-alpha hydroxylase enzyme, the 125 dihydroxy, your vitamin D level will be decreased. That is most important. 125 vitamin D level is decreased, your parathyroid hormone is increased, your calcium level is decreased. That is most important. This is the only form of rickets where we can get classical features of classical hypocalcemia. In other cases, we can get sometimes low calcium level or sometimes normal calcium level. But here we will get hypocalcemia and features of hypocalcemia. So this is the classical feature of vitamin D dependent rickets type 2. Type 1. Type 2 is because of your absorption, your peripheral action, because of the resistance of the activated form of vitamin D by the peripheral tissues. This is the simplest form, vitamin D activation rickets. Your vitamin D D2 and D3 and sun exposure to skin, UVB light exposure, vitamin D deficiency occurs because of the absorption nutritional defect. At this level, your 25 hydroxy vitamin D formation occurs because of activation at the liver by the 25 hydroxylase enzyme. Then at kidney, because of the activation by the 1-alpha hydroxyl enzyme, we are getting the activated form of 125 hydroxy vitamin D. Suppose there is a defect in the 1-hydroxylase enzyme, then the vitamin D dependent rickets type 1 we can get. Where what is the classical difference? Calcium level will be low, phosphorus will be low, parathermal will be high, but defect is your calcital. Calcital will be severely low. Very low level of calcital we can get in vitamin D dependent rickets type 1. But in vitamin D dependent rickets type 2, your calcital level will be more. The resistance to the activated form of vitamin D occurs in vitamin D dependent rickets type 2. So here the calcital level will be more. The difference is calcital level will be low in type 1 dependent rickets and it is high in type 2 variety of vitamin D dependent rickets. This we have to remember. Next, figure 8 or snowman appearance in X-ray is seen in which variety of congenital heart disease? It's very simple. This is the TAPVC, total anomalous pulmonary venous connection. This is a classical picture of showing figure 8 appearance or snowman appearance in a case of TAPVC. Next, identify the ECG. What we are getting in this ECG? Where we can get this such ECG in our exam and we have to identify which variety of ECG is this. What we are getting is the scooping of your ST level and your reverse tick sign. This is reverse tick sign is a classical to your dejection effect. So dejection effect, what we are getting? Scooped ST segment and reverse tick segment ST segments. Then what are the other features? What other cardiac abnormality you can get in dejection toxicity? Is the ST segment depression, your T wave inversion, you can get sinus bradycardia, uniform or multiform ventricular extrasystole, ventricular tachycardia, flutter or fibrillation, paroxysmal arterial tachycardia, your arterial flutter and fibrillation, SA nodal block, bundle branch block, first degree, second degree, and third degree heart block. All these we can get in your dejection effect or dejection toxicity. Please like and share this video and subscribe to my channel. Thank you.